Have you ever wondered if there could be a link between infertility and a slightly higher risk of autism in children? This intriguing question has been at the forefront of a recent study. The researchers have delved deep, investigating this potential connection, and their findings may just surprise you. Why is this topic so important, you ask? Well, understanding such links can provide invaluable insights for those planning to start a family or already navigating the joys and challenges of parenthood. It's all about equipping ourselves with the best knowledge out there to make informed decisions. The study, which included a staggering 1.4 million children, compared the risk for autism spectrum disorder in offspring of patients with infertility who did not receive fertility treatment to those who conceived without assistance. And the results? They were indeed captivating. But don't worry, we're not going to leave you hanging. Stay tuned as we delve into the details of this thought-provoking study. A large population-based cohort study recently shed some light on this complex issue. This study involved a significant sample size of approximately 1.4 million children, making it one of the most comprehensive investigations into this subject to date. The researchers compared two groups of parents, those who had experienced infertility but did not receive fertility treatment, and those who conceived without any assistance. The aim was to investigate any differences in the prevalence of autism spectrum disorder, or ASD, in the offspring of these two groups. The results were fascinating. They found that there was a 20% greater risk for ASD in the children born to the subfertility group compared to those from the unassisted conception group. This suggests that some connection exists between parental infertility and the development of ASD in children. But of course, a single statistic can't tell the whole story. The question that naturally follows is, why? What could be causing this increased risk in the subfertility group? To answer this, the researchers turned their attention to potential mediating factors. These are elements that could influence or explain the relationship between parental infertility and the increased risk of ASD. They looked into a spectrum of factors which included preeclampsia, cesarean birth, multifetal pregnancy, preterm birth, and severe neonatal morbidity. But what might be the cause of this increased risk? The study also examined potential mediating factors. The researchers considered several potential factors that could mediate the link between parental infertility and ASD in children. Let's delve into these variables. First on the list is preeclampsia. This is a pregnancy complication characterized by high blood pressure and signs of damage to another organ system. It could potentially influence the risk of ASD given its impact on the overall health of both mother and child. Next, we have cesarean birth, commonly known as a C-section. Some studies suggest that children born through this method may have a slightly higher risk of developing ASD. However, it's important to note that this correlation doesn't imply causation. Many factors leading to a cesarean birth, such as a complicated labor, could also contribute to ASD risk. Multifetal pregnancy is another mediating factor. In other words, pregnancies involving more than one baby. This condition often leads to preterm birth, another factor on our list, and children born prematurely have been found to have an increased risk of ASD. Lastly, severe neonatal morbidity was examined. This term refers to serious health problems affecting newborns. These conditions can have long-term effects on a child's neurological development, which might be linked to ASD. These mediating factors could all contribute to the slightly higher ASD risk found among children born to parents with infertility. However, each of these factors is a complex issue in its own right, and their interactions are not fully understood. So, does this mean that infertility treatments are to blame for the higher autism risk? Not quite. The researchers concluded that it is underlying infertility, rather than the fertility treatments themselves, that may be the driver of the link between parental infertility and ASD in children. This is the crux of the recent study that examined the link between parental infertility and autism spectrum disorder in their offspring. The study found a slightly increased risk of ASD in children born to parents with infertility. However, it's important to stress that this risk is not directly related to fertility treatments. It's more likely due to the underlying issues that cause infertility in the first place. This finding could have significant implications for individuals grappling with infertility and those contemplating fertility treatments. It's a reminder that the journey to parenthood may come with complex challenges, and each couple's situation is unique. Understanding the nuances of these findings can help shape discussions with healthcare providers, ensuring that each individual or couple is equipped with the information they need to make informed decisions about their fertility journey. This study underscores the need for improved patient education on fertility factors and the reduction of multiple pregnancies. It's a reminder that every piece of knowledge helps us make more informed decisions when it comes to our family's health.